Hello, everybody. It's Nursing with Hart, PhD. Again, it's Dr. Hart. And today I'm going to talk about suicide prevention. It's a very serious topic. It can be tough to talk about these topics, but it is very important as a nurse, and especially if you plan to go into the psych area of nursing, or if you're going to be working on any unit. These are questions you're going to be asking your patients. These are assessments that you're going to be making that are very important to maintain your patient safety. Okay, so let's get started. So suicide affects all ages, all walks of life, all genders, all religions. It doesn't discriminate. And so there are risk factors for groups, populations like American Indians, Alaska Natives, the military veterans, the LGBTQ community are at a very high risk for suicide. People who have been in welfare settings, socioeconomic status, and people in prison. That's just to name a few. I will touch on a lot more risk factors for suicide. Cultural norms. So some cultures don't believe in suicide. They don't believe that it's a true thing. They think that it's goes against their religion. It's totally disregarded in some cultures and some religions. So this is considered an irrational act. Most people who have attempted suicide at some time of their life, they have most likely an underlying disorder of depression or some other mental diagnosis. Here are risk factors for suicide rates, where the rates are higher than a normal. Single, never married people. Divorce. Someone who's been divorced is at a high risk for suicide. Divorced men are twice as likely to die by suicide than married men. Widows and widowers. Those are men and women who have lost their spouses by death. Okay, and so we have to look at, I did cover in the depression content, I covered that people go through many, many losses in their life, and even divorce is a loss of a marriage. There can be loss of a house, loss of a spouse, and these are all going to put the person at higher risk for depression and or suicide. Gender. Women attempt suicide more often, but more men succeed. What does that mean? So that means men use a more lethal means. Women tend to use a lesser lethality of means, which means men tend to use weapons when they attempt suicide. Women tend to use pills, which is a less lethal means of carrying that out. Transgender individuals who are part of the LGBTQ community, again, higher risk for suicide in their population, in their community. Risk of suicide as you get older, the risk increases because of the depression, social isolation that older people go through, chronic pain, comorbidities, diabetes, hypertension, COPD, emphysema. I could go on with the other comorbidity physical ailments that people go through as they get older. Common methods are for males, adolescent males, firearms, adolescent females is suffocation. So religion can be more of a protective factor. So suicide rates among Protestants and Jews have been higher than Roman Catholics or Muslim populations. But religious affiliation can be a protective factor against suicide attempt because the person has more support. They have more of a support system within their congregation and the people they associate with or the people they gather with in their religious groups. Socioeconomic status. That's what class you're in, middle class, lower class, your income levels, your access to support, your access to transportation, access to what area you live in. Do you live in a high crime area? Do you live in a depressed area? Depressed states, the depressed areas of each state will affect someone's risk for depression and suicide. So certain occupations have higher suicides, doctors, artists, dentists, law enforcement officers, think of the stress that they have in their jobs, lawyers and insurance agents all have a higher rate of suicide among them. Obviously, or not obviously, higher suicide risk among people who are unemployed and occupations with high stress, like I mentioned, law enforcement officers, isolation, lack of health care, and someone who goes through repeated exposure to painful stimuli, and nurses have a higher risk for suicide. Someone who has a lot of pain from those health issues they're going through. Ethnicity, these are some statistics on ethnicity. 15% for whites, 13% American Indian, Alaska Natives, 6% African Americans, and Asian Americans is 6%. Other risk factors, there are quite a few. People who have been hospitalized for a psychiatric mental illness. I put in here and I bolded it, suicide risk may increase early in the treatment with antidepressants. So I talked about this in the depression content. A patient who has started an antidepressant, let's start with the depressed patient who has not started an antidepressant yet. They are lack of energy, sometimes don't have energy to get out of bed, don't have energy, don't want to talk to people, don't have physical energy, a lot of fatigue. And then the person starts on an antidepressant. The reason the doctor will typically only prescribe a short amount of pills is so that the person has to come back to the psychiatrist for another assessment to see if they are still having suicidal thoughts, because now that they've started on the antidepressant, the mood might lift, they have more energy, so they're still having the suicidal thoughts. So now they started on the antidepressant. now they have the energy to carry out those thoughts. And so the suicide risk is higher once the person has started on early in treatment, when they have started on antidepressants. They must be assessed by the nurse and the psychiatrist. Okay, other risk factors, other comorbid mental health disorders are listed here: schizophrenia, bipolar, personality disorders, eating disorders, anxiety, and substance use. And also lack of sleep, not being able to sleep. Other risk factors: heavy use of alcohol, withdrawing from stimulants, and as the person begins to crash, say that they're withdrawing from cocaine, they're going to crash and sleep a lot, and that's normal, but it also puts them at a higher risk for suicide. People who are having command hallucinations. What are command hallucinations? I will cover that later in the schizophrenia content. Command hallucinations is someone who is hearing voices, and these voices are telling them to do something. So if the voices are telling the person to hurt themselves or others, this puts the patient at a very high risk for suicide. Also having chronic pain with a serious physical illness, high risk for suicide among gay men, lesbians, LGBTQ individuals. This community, LGBTQ community, goes through discrimination, microaggression, macroaggression, and online cyberbullying, all of that. So that puts them at a high risk for suicide. Someone with a family history of suicide, if they've lost a loved one, and do they have lack of employment, lack of income. These are all questions that you would ask. The nurse would ask these questions in a specific suicide risk assessment, and you should ask these questions also in an admission of someone with a mental health disorder. These questions would be included in the admission process. Other risk factors: physical bullying, cyberbullying. Okay, girls who are going through psychological bullying or online bullying are at higher risk for suicide. With the assessment, okay, now I'm going through the nursing process, and the first step in the nursing process is assessment. Okay, so as a nurse, it is very important for you to identify the patient's thoughts, their intentions, and their behavior. And those are where you're going to use your keen nursing assessment skills in distinguishing, asking them certain questions. Have you had any suicidal thoughts or any thoughts to harm yourself or others? If they say yes, then you will ask a question like, do you have a plan on how you would carry that out? If they say yes, then you would ask if they have access to weapons. You would ask other questions. How long have you had these thoughts? Have you shared this with your therapist? Have you shared this with your psychiatrist? And you are going to dive deeper into these questions. Don't be afraid to ask. Some misbeliefs are out there that if you ask about suicide, it puts them at a higher risk, and that's just not true. If they're having these thoughts, they're having the thoughts. And whether or not you ask about it, it's actually more important that you determine that they're having suicidal thoughts, okay, than to be afraid to ask. So you would ask such other questions like, how often do you think about suicide? So the risk, the more specific the plan, the higher the risk, and that's the lethality risk. And that was in a test question that I went over on the depression chapter. And if they have ruminations or repetitive thinking, detailing time, place, and means and how they would carry it out, that's going to increase lethality. And that person should be put on a 24-hour observation or safety watch. Okay, and notify the doctor. Put this in report. Let the next nurse know what's going on. And you would observe the client at certain intervals, okay, and maintain close observation. There may be a one-to-one contact, constant visual observation, or every 15-minute check at irregular intervals. Possibly place the patient in a room close to the nurse's station. Do not assign to a private room. Someone who is having suicidal thoughts should not be in a room by themselves. Accompanied to off-unit activities. If attendance is indicated, they may need to be accompanied even to the bathroom. So the more specific the plan, the more likely the client will attempt suicide. So the demographics assessment. Here's some information on different demographics. Age, adolescents and elderly are at a high risk, in a high risk group. Gender, males are higher risk. Ethnicity is high rates of suicide among Caucasians, followed by American Indians and Alaska Natives. Marital status, single, divorced, and widowed people are at higher risk for suicide than are married people. And I would say that's because the married person has that support system. They have a spouse to provide the support. Socioeconomic status, people in the highest and lowest socioeconomic classes are at a higher risk than those in the middle class. Occupations, I mentioned some of those before. Healthcare professionals, especially doctors, law enforcement officers, dentists, artists, mechanics, lawyers, insurance agents, have been identified as occupational groups that have greater risks for suicide. Occupations with high stress, isolation, lack of access to healthcare resources, and repeated exposure to pain or painful stimuli. Religion, I mentioned, is actually a protective factor because someone in a religion or in a church congregation has more support that they can turn to. Family history of suicide puts the person at a higher risk. And that is also one of the suicide risk assessment questions. Do you have has anyone in your family ever committed suicide? Military personnel, active duty, and veterans are at a higher risk for suicide. Most common method is firearms, which accounts for 60% of all suicides among military members. I was talking about lethality. So the use of the lethality is when someone who has already made an attempt provides meaningful information about their intent to die. The use of firearms, hanging, and suffocation are considered highly lethal methods. Assessment data must be collected by the nurse, and these should be questions that are asked of the patient every time the nurse interacts with the patient. Okay, so MedPass, you're going to see the nurses or hear the nurses asking these questions. They're going to also ask about sleep is important, asking about how you're sleeping, how is your appetite, and of course, when was your last bowel movement? All questions that they are going to be asking. The person who is thinking about suicide, they may give clues in the things that they say to you. They may say, well, you're not going to see me much longer after this. They may say something like that, and those are clues. They may say something like, I want to die. They may say direct statements like, I'm going to kill myself. Indirect statements, I won't be around much longer. I don't have anything worth living for anymore. And also, if the person is giving away prized possessions, this is the sign that they are contemplating suicide. Their interpersonal support system, if a person has a lack of a meaningful network, that puts them at a higher risk for suicide. The life stages issue, let's go back to precipitating stressor, adverse life events, more risk factors may lead to suicide, especially depression. Relevant history, have they had lots of failures or rejection in their life? Life stage issues, have they had loss and disappointment in their life? If there is a family history of alcohol use, substance use, depression, these are all risk factors for someone with a mental illness to be at a higher risk for suicide. Also the presence of chronic illness, terminal illness, cancer. Do they have coping strategies? That's another question that the nurse should ask. Have you handled previous crisis situations? Or how have you handled previous crisis situations? How does this situation differ from your other ones? Presenting symptoms. There are screening tools that the nurse can use. The first one is, the acronym is Path Warm. That's a mnemonic that you can use to remember. Is Path Warm. The I is ideation. Do they have ideas of suicide? Substance abuse. S is substance abuse, that they had history of substance use. P is purposefulness. Do they have a purpose in life? A is anger. Are they expressing anger? T is trapped. Are they feeling trapped? Hopelessness. Are they feeling hopeless? Withdrawal. Have they been withdrawing from other people? Anxiety. Are they having anxiety or expressing or agitation? Changes in sleep pattern. That's why it's very important to ask about sleep. Recklessness is the R in warm. Are they engaging in reckless or risky activities? And M is mood. Okay. Are they expressing dramatic mood shifts? And the NIMH is another screening tool for suicide. These are some nursing diagnoses. Risk for suicide related to feelings of hopelessness and desperation. Hopelessness and ineffective coping. Planning and implementation phase of the nursing process. Okay, some of the goals that you can set for the patient for following discharge. Guidelines and interventions. The person should have immediate access to support systems, be connected to a system of care. The nurse can make arrangements with the client to stay with family and friends after discharge, recognizing warning signs, identifying coping strategies, identifying supportive family members. So when you're doing your nursing assessments for suicide and depression, ask directly, be direct, talk openly and matter-of-factly about suicide. Listen actively and encourage the patient to express feelings, including anger. Ask that direct question. Do you ever think about killing yourself? Take any hint seriously and report to the doctor or put them on a safety watch. Do not keep secrets. Suicidal individuals, they're on the fence about dying, and suicidal behavior, it might be a cry for help. Okay, and they may confide in you about their suicidal thoughts. They may ask you to keep it a secret. You're going to let them know that as their healthcare provider, if you're expressing suicidal thoughts, it's their obligation to let the healthcare team know that you're having these thoughts. Be a good listener. Okay, some people feel it awkward to put it into words, but it's very important that you do that. Long-term goals are individual and group therapy, determining your strengths and weaknesses, determining your support groups, where is your support and how to reach them when you need them, who to contact, okay, and once the immediate crisis is resolved, then extended psychotherapy may be indicated for the patient. Okay, and the suicide hotline. Okay, suicide hotline is 988. You can call it or text it, and you will receive someone on the other line who is a professional, and they will talk with you and get you the help that you need. Okay, 988. Help is available. Have a great day.